Back now on Triad Today, we're going to talk about advocating for patients, and that's a very important thing. And speaking of that, a very important man is seated next to me, Jay Paul, our director, if we can meet. Dr. John Walker, who is Chief Medical Officer for Cornerstone Healthcare, and welcome to the program.
Thank you very much. Pleasure to be here.
Let's clear up one thing, and you can educate me on this and the folks at home. As a Chief Medical Officer at Cornerstone, what are your responsibilities? What do you do?
I have oversight primarily over the physicians, and the areas of the company that I cover are our quality department, our compliance and patient safety, our IT department, and I'm also responsible for developing new practices.
Right. So you're really helping the physician, but at the same time, pardon the expression, you're advocating for the patients too. So you really got a dual purpose there.
Very much so. Our whole compliance and patient safety department revolves around that. Our quality department revolves around building the best possible programs, processes, procedures that we can develop to enhance patient care.
Yeah. Now, speaking of patient advocate, what is that? How can you sum up what a patient advocate is?
Cornerstone has developed a service line, if you will, called Patient Care Advocates. And our patient care advocates analyze our population database for risks, and specifically right now we're focusing on diabetes.
Okay.
So we have this software in place that all our lab data are downloaded into the software, and our advocates go through the software, identify patients at risk, and try and get them the care that they need, whether it's another lab test, an imaging or x-ray study, or office visit with their physician or diabetic educator. So they are looking at the patients from the standpoint of what can we do as a company to improve their health.
So this is a patient who has come through the Cornerstone system in one way or another, so that data's in there, and you're saying that the patient advocates can take that data and then make an actual contact? You're talking about a telephone call?
Absolutely. This is a very hands-on approach. There are some places that try and do this with telephone contacts to try and get people into the office. We felt that we wanted to really be the company that reached out to the patients.
Yeah, that's pretty innovative, I mean, when you think about it.
We don't know of anyone else doing this type of a thing in our area. It really gives a patient an opportunity to ask questions. It gives our advocates an opportunity to answer the questions if the patient has them,
right,
and really explain why it's important for them to get this type of health care.
I'll get back on track in a second. We didn't rehearse this. I'm going to put you on the spot, but it just dawns on me, what if I get a phone call? I've got, I'm a diabetes patient. I've been in this, my information's in the system. And I get a phone call and it says, I'm so-and-so, and would this be a doctor, a nurse practitioner, a technician?
It is a certified medical assistant.
Okay, they say, I'm John Doe or Jane Doe, I'm a certified medical assistant. How do I know that that's who they are? I mean, because in this whole era of privacy and everything else, I want to make sure my information is protected, it's not being misused. I guess you've thought about all that, right?
Well, the patient could certainly ask any kind of questions of our patient care advocates, such as, okay, if you are who you say you are, please tell me what my date of birth is,
right,
what my social security number is.
Good idea.
Because our advocates are working directly off the patient's electronic medical record.
Absolutely.
So they have all the patient's information right there.
Now, other than diabetes, are there other things that they're going to target if they see a problem and that they want to try to get you back in, do some preventative? Or?
Yes, we're going to look at hypertension, high blood pressure, high cholesterol levels. We have the ability to look at our pediatric patients who have asthma, making sure they're getting the right care. And the program that we're working with is going to allow us to extend the range of that as well.
Now, I understand.
Those diseases.
Oh, I'm sorry, I didn't mean to interrupt you. I understand through the grapevine that 13, correct me if I'm wrong, but about 13 of your primary care practices received an honor recently. What was that about?
Yes, we have 13 of our adult primary care practices that were recognized by the National Certification for Quality Administration, the NCQA, as patient-centered medical homes.
Okay.
And that is a very difficult recognition to achieve because you have to be at a level of patient care that is patient-centered.
All right, well, that's great. I mean, I know you couldn't be prouder of that, and it's
We're very proud of
great
that.
recognition. Here's the info on screen. If you want more information, here's the website I meant to say, www.cornerstonehealth.com, and find out all about this system and the people that are making the phone calls. I just think this is a very innovative and very helpful thing. We're going to save lives, I think. Thanks, Doc.
Thank you very much.
All right.
Pleasure being here.
We'll be right back.